In this practice we will learn how to adapt the bed in the patient's mouth, a special technique for doctors, physiotherapists and osteopaths. The bed arrives in your hands like this. We need a cup big enough for the device to fit into it. And also a boiler to heat the water to 100 degrees. We must have a container with hot water and a container with cold water together with the boiler before starting work. When the water has reached 100 degrees, that is, boiling, we put it in one of the containers. Before handling the bed we must wet our hands in cold water. At that moment we take the bed and put it in the container with hot water. Then we leave it for about 15 to 20 seconds in the water. We have to observe the plasticity of the device. Slowly, controlling with our hands, we'll see when the time is right. To avoid, during the handling of the device, Vaseline can be used. It spreads evenly throughout the hands to have more sensitivity in handling. Now we proceed with the first adaptation step. Once we check the plasticity of the material, we proceed to lengthen the device as shown. It is pressed on the inside, with the fingers, as seen in the video. With this we lengthen the device to be able to later adapt it to the patient's mouth as we will see. With the pressure of the fingers, when the material is plastic enough, the shape of the bed is lengthened, in order to later finish the modeling in the patient's mouth. To adapt the bed in the patient's mouth, we must position ourselves in the rear part, which allows us to manipulate it more. It is positioned in the mouth and centered as shown. With the index finger the palatal part of the bed is adapted and with the thumbs, the vestibular shield. The front guide of the device is also preformed. After the adaptation, the bed must be cooled in water, to avoid losing the modification. From behind the patient, the bed is inserted. And with the index fingers its stability is controlled. Once stability is controlled, the patient is asked to gently close their mouth, without squeezing too much, and proceed to check that there is uniform support on the sides. We must observe a support in the entire lateral line in a uniform way. This will give a good occlusal stability of the device. We must always remember that the device must be placed in cold water, to prevent the correction made from being lost. At this time we must check if the posterior part of the bed reach the last molar. If not, we must lengthen the device. As we can see, with the index finger, we proceed to touch the back of the device, to verify that it reaches the last dental element present in the mouth. To lengthen the back, the material must be very plastic. Therefore, it is necessary to have the water boiling. Otherwise we will not be able to model the device. Otherwise, we must change the water and reheat it, so that the material reaches the plastic modeling state. The boiling water is placed in the container. And then we only place the back part that we want to lengthen. As we see in the video, this is the part that we must place in the hot water. This part will be put in the container as seen. It should be left for at least 40 seconds, and control the plasticity. This is how to place the bed for the elongation of the back. Once plasticity is reached, the posterior part is lengthened with the thumb and forefinger, and the curve of spay is momentarily preformed. After that, it is immediately cooled to avoid losing the correction. The next step is to check in the patient's mouth. If the modification made reaches the end of the mouth, the next step is to lengthen the other part of the device, with the same procedure that we have done before. As you can see, the curve of spay is always performed, then always place the device in cold water so that the adaptation made is not lost. It is placed in the mouth and it is controlled that both extremities reach the last molar present in the mouth. It is also checked if there is enough overjet and overbite in the area of the anterior guide. This guarantees good protection in the TMJ. Now we must functionalize the device. To do this, the protrusion and laterality movements are carried out, holding the device with the hand as shown in the video. The patient must make movements forward, backward, right and left as we see. As you can see, the device must not be adhered to the patient's teeth. This avoids the blockage of cranial sutures and craniosacral respiration. Here we see the device already adapted and functionalized. After the adaptation of the device, we proceed to its postural control. First, control the upper and lower cervicals as seen in the video. Control mobility in all directions of the cervical spine, sideways, up and down. Second, control is the laterality of the head that gives us an idea of the freedom of movement of the lower cervical. Then we control the high cervicals moving up and down. We must control that the head reaches the maximum extension backwards and downwards. The next step is to control the convergence of the eye, observing if it improves. Many times it improves immediately, but not always. We must control the activity of the muscular chains through the walk test, carried out first with an open mouth, and then with a closed mouth. The last control, for those who have the posturometer, is the objective measurement with this instrument. In the tracings we can observe the notable change of the measurements. Mainly, the decrease in postural overload immediately. It is also remarkable the improvement in the K-pongee areas and in the barycenter of the body. The posturometer is an objective instrument that allows us to observe the improvements in the static posture of the body. In the tracings we see how the improvement is immediate. Then, it will still change positively. B.E.D is obviously a device that nullifies the negative effect of the craniofacial system on the muscular chains as we have seen.